Signs and symptoms of common types of anxiety in young children. Anxiety is something that can affect any of us at any time and is completely normal. Though, when you see that your child is anxious, it can be distressing. Here we will go through some of the common causes of anxiety in children and some of the signs and symptoms of these common causes of anxiety. Common causes and types of anxiety in children. There are 6 common causes and types of anxiety, which will be mentioned shortly. Click the timings in the description if you wish to skip ahead to the specific type of anxiety. The first 2 are the type of anxiety which is most common in young children, under 8s. Though, your child's anxiety may still be caused by the others. The first one is specific phobias, which is having extreme fear about a specific thing or situation, such as dogs, insects, or going to the doctor. The second is separation anxiety, which is being very afraid when away from parent. Other types of anxiety which may affect your child is social anxiety, being very afraid of school and other places where there are people. General anxiety, being very worried about the future and about bad things happening. Panic disorder, having repeated episodes of sudden, unexpected, intense. And obsessive compulsive disorder, which is the recurrent and persistent thoughts, impulses or images that are unwanted and cause anxiety and distress. Specific phobias. Specific phobias are defined as having an intense fear of a specific thing or situation. This is very common in young children and most don't last very long. It would be classed as a phobia if it persists for longer than 6 months and affects the child's routine. For example, they won't go outside because they're scared a dog might come. Generally, with phobias they will grow over time without intervention, as opposed to most childhood fears which reduce over time. Also, unlike adults, children often don't recognize their fear is irrational. Some signs and symptoms include, starting with physical signs of specific phobias, which include increased heart rate, sweating, trembling or shaking, shortness of breath, feeling of choking, chest pain or discomfort, upset stomach, numbness, chills or hot flashes, looking flushed. Some things your child might say are, "It's going to bite/sting me. I can't handle it. It'll be awful. What if I vomit?" Behavior. Avoiding the feared stimuli or locations where the stimuli might exist. Making parents check things first, for example, make sure a room is free of bugs before bedtime. Asking a parent to be present or available. Running away. Crying. Clinging. Tantrums. Treatment. This involves the gradual desensitization to the fear over time. So for example, if they have a fear of dogs, potentially showing pictures and videos of dogs, before introducing a real dog at a distance until they are comfortable to interact with it. During this time, the fear will gradually disappear or reduce significantly so that it doesn't affect their daily routines. Separation anxiety. Separation anxiety is being very afraid of being away from a parent or carer or even their home. This is very common in children 3 and under, though older children are usually able to leave their parents for short periods without experiencing distress. Separation anxiety becomes more serious if it interferes with the child's usual activities. For example, they are unable to attend school. They worry their parents may suffer harm when they're separated. Experience physical symptoms like nightmares, sleep problems, or nausea and headaches. Physical signs. Stomach aches, dizziness, racing heart, general aches and pains, headaches, shortness of breath. Thoughts. Note, very young children may be unable to identify specific fearful thoughts. What if something bad happens to mom or dad? What if I get lost? What if grandma doesn't pick me up after school? What if I get kidnapped? What if I get sick and mom isn't there to help me? Behavior. Refusing to go to school. Avoiding participating in new activities or going places without a parent. Refusing to sleep alone. Nightmares. Asking a parent to be present or available. Crying or having tantrums. Refusing to be alone in a room. Treatment. Separation anxiety can be eased by practicing separation by leaving your child with a caregiver for brief periods at first. As your child gets used to separation, you can gradually leave for longer. Schedule separations after naps or feedings. Develop a quick goodbye ritual. Rituals are reassuring and can be as simple as a special wave through the window or a goodbye kiss. Leave without fanfare. Tell your child you are leaving and that you will return, then go. Don't stall or make it a bigger deal than it is. Follow through on promises. For your child to develop the confidence that they can handle separation, it's important you return at the time you promised. Have a consistent primary caregiver. Reassure your child that they will be just fine. Setting consistent limits will help your child's adjustment to separation. If it does persist, then the next step would be to contact a behavioral therapist. Social anxiety. Social anxiety is being very afraid of school and other places where there are people. This is usually found in older children, but can affect children as young as preschool age and can persist into adulthood. It is categorized by a fear of at least one social situation, for example, eating in school or playtimes at school. Apparent fear when dealing with peers as well as when interacting with adults. Avoidance or intense dread of feared situations. Interference with school performance/attendance and the ability to interact with peers/develop and maintain relationships. Physical. Stomachache. Blushing. Sweating. Shaking. Muscle tension. Irritability. Feeling detached from one's body, derealization. Thoughts. Note, very young children may be unable to identify specific fear thoughts. I'm going to say something stupid. They won't like me. I'm an idiot. People can tell I'm anxious. Behavior. Refusing to go to school. Avoiding participating in new activities or going places. Asking a parent to be present or available. Declining invitations to social events. Not answering in class. Crying or having a tantrum. Refusing to go on a play date without a parent. Mumbling or poor eye contact. Staying home on weekends rather than hanging out with friends. Treatment. Treatment comes through practice. One way this can happen is through exposing your child to the situation, either through imagining the situation or social event or through actually experiencing the situation. Another way you can help your child manage their anxiety is by social skills training. This involves various exercises such as modeling, rehearsal, and role-playing designed to help people learn appropriate behaviors and decrease anxiety in social situations. Though, as there may be an underlying reason for the social anxiety, for example, bullying, it is important to explore what could be causing the anxiety. General anxiety. General anxiety is described as being very worried about the future and about bad things happening. This usually affects children aged 6 and over. It is characterized by excessive worry and anxiety over a number of things. For example, common worries include worrying about performance at school/exam results, performance in sporting events, being punctual for school/appointments, family issues in general, world events, health. Children with generalized anxiety also frequently seek the approval or reassurance of others and have a people-pleasing type personality. Physical signs. Fidgety, amped up, unable to sit still. Irritable. Tired. Muscle pains, often in the neck and shoulders. Headaches. Stomach aches. Thoughts. Note, very young children may be unable to identify specific fear thoughts. What if I fail my test tomorrow? What if there is an earthquake and the house gets destroyed? What if everyone thought my project was stupid? What if climate change keeps getting worse? What if my mom develops cancer? What if I don't get into university? What if someone breaks into our house while we are out? Behavior. Tantrums. Snapping at others. Difficulty paying attention or concentrating. difficulty falling or staying asleep, or disturbed/interrupted sleep. Excessive studying, reassurance seeking, ruminating, repeatedly thinking over situations. Excessive or unreasonable list making, procrastinating, refusing to go to school. Treatment. The best way to help your child with this anxiety is to talk to them. At this age, they will find it much harder to understand that their fears are irrational, so it's important to show some understanding but not to validate their fears. If it does persist, it is important to seek advice from your GP as soon as possible. Panic disorder. Panic disorder is described as having repeated episodes of sudden, unexpected, intense fear. It can be characterized as when a child suffers at least 2 unexpected panic attacks. This is followed by a period of time, usually of at least 1 month, where there is concern about the possibility of having another panic attack, which can lead to situations where children avoid situations they fear a panic attack might happen, affecting their normal development. It is important to note that having a panic attack does not mean that a child has a panic disorder. Panic attacks can occur in other forms of anxiety too. Panic attacks become a problem when the child starts to worry excessively about having them, or the panic attacks are unexpected, or there is no clear reason for the panic attack to have occurred. Physical. Racing or pounding heart, sweating, shaking or trembling, shortness of breath or feelings of being smothered, feeling of choking, chest pain or discomfort, chills or hot flashes, nausea or upset stomach, dizziness or lightheadedness, numbness or tingling sensations. Thoughts. Note, very young children may be unable to identify specific fear thoughts. A sense of things being unreal or feeling detached from oneself, derealization. Fear of losing control or going crazy. Fear of dying. Behavior. Avoiding going to places where a panic attack has happened before. Carrying medicine, gum, or a water bottle. School refusal. Being in contact with a safety person by phone/text at all times. Skipping school. Sitting near an exit or in an aisle seat. Wearing loose, cool, or less restrictive clothing. Avoiding exercise, caffeine, or any activity that activates the body. Treatment. If your child is actively having a panic attack, you can work them through it by staying in control, stay calm, and talk to them in a gentle voice. Doing breathing exercises. Shifting their focus. Challenging negative thinking. Reassuring them. Talking to them and teaching them about their panic attacks and reassuring them can help prevent frequent panic attacks. Though, if they persist, speak to a health professional. Obsessive compulsive disorder. Obsessive compulsive disorder is the recurrent and persistent thoughts, impulses, or images that are unwanted and cause anxiety and distress. Again, this usually occurs in older children but can start as young as 5 or 6 years old. Obsessional thoughts are often unrealistic and irrational, and are not simply worries about real-life problems. Compulsions are repetitive behaviors or rituals. Physical. Stomach aches, dizziness, racing heart, shallow breathing, headaches, muscle tension, shortness of breath, feeling detached from one's body, derealization. Thoughts. Note, very young children may be unable to identify specific fear thoughts. I'm responsible for that accident. What if I get sick? If I don't get an A on this paper, my future is ruined. Am I attracted to that guy? Do I find him good looking? This must mean I'm gay. What if I'm sick but I don't know it, and then I get my parents sick when I touch them? I can't stand not knowing. Behavior. Asking parent to buy extra toilet paper or cleaning supplies. Making parents wash their hands before making a meal. Washing hands and body excessively. Checking with parents that he didn't make a mistake. Repeating certain phrases in multiples of 2 or 4. Doubting something has been done correctly. Avoiding touching doorknobs, handles, etc. Treatment. In order to help your child, it is important to remain calm with your child and remember that the OCD is out of your child's control. Supporting your child and making gradual changes will be important. If there is one ritual that they find easier to give up, start with that and work your way up to others. If you think your child has OCD, it is important to get it diagnosed as soon as possible so that treatment can help as soon as possible. So, those are the signs and symptoms of the following 6 common types of anxiety. Specific phobias. Separation anxiety. Social anxiety. General anxiety. Panic disorder. And obsessive compulsive disorder. You can further help your child overcome their anxiety with this exciting new story. Evie's Super Emotions, a children's book about managing anxiety and emotions. This book is a great way to introduce the idea of anxiety to your child and get them communicating their emotions better. Find out more about the book by clicking the link in the description. Thank you for watching and good luck with supporting your child.